Hello everyone, my name is Lisa and welcome to the channel. Today, we're diving deep into the subject of borderline personality disorder, or BPD. We're looking at its history, current understanding, an in-depth look at diagnostic criteria, treatment options, and the importance of seeking professional help. The term borderline was first used by psychiatrist Adolf Stern in the early 20th century to describe patients on the borderline of neurosis and psychosis. By 1980, the American Psychiatric Association officially recognized BPD. Today, we understand BPD as a condition stemming from genetic, neurological, and environmental influences. We've also seen a shift towards more compassionate, person-centered language when discussing BPD. The DSM-5 lists 9 primary symptoms for BPD diagnosis. At least 5 must be present, which are: fear of abandonment. People with BPD often exhibit an intense fear of being left alone or abandoned, even when there's no risk. This fear can lead to frantic efforts to keep others close, sometimes through manipulation or even threats. Unstable relationships. Relationships of those with BPD can be characterized by intense highs and lows, with a tendency to idealize others, followed by dramatic shifts to devaluation, often triggered by perceived slights or disagreements. Identity disturbance. BPD often comes with a markedly unstable self-image or sense of self. This can manifest as shifting goals, values, and aspirations, often leading to sudden changes in jobs, friendships, or even sexual identity. Impulsive behavior. This symptom is characterized by actions that are potentially self-damaging and performed without a consideration of the consequences. These behaviors can include reckless driving, problematic substance use, binge eating, or unsafe sex. Suicidal or self-harming behavior. Recurrent suicidal behaviors, gestures, or threats, or self-harming behaviors like cutting are common. These incidents are often in response to fears of rejection or separation. Mood instability. People with BPD experience intense emotional swings, often lasting a few hours and rarely more than a few days. These might include periods of intense dysphoria, irritability, or anxiety. Chronic feelings of emptiness. This can be described as a pervasive sense of unhappiness, loneliness, or dissatisfaction. Despite having a full life, individuals with BPD can still feel empty or as if something is missing. Intense, uncontrolled anger. This often involves frequent displays of temper, consistent anger, or recurrent physical fights. These outbursts can lead to significant conflict with friends, family, and colleagues. Paranoid ideation or severe dissociative symptoms. Temporary bouts of paranoia or dissociative symptoms often occur in response to stress. People with BPD may feel disconnected or detached from themselves, their thoughts, or their bodies during these episodes. Remember, BPD diagnosis is a complex process that should be undertaken by a qualified health professional. As for treatment, there are several effective options. Dialectical Behavior Therapy, DBT combines cognitive behavioral techniques with mindfulness and acceptance. It helps manage painful emotions and reduces conflict in relationships. Cognitive Behavioral Therapy, CBT assists people with BPD in identifying and changing core beliefs and behaviors underlying inaccurate perceptions of self and others. Schema Therapy. This therapy targets maladaptive coping styles and life patterns that stem from negative perceptions of oneself and the world. Medication. No specific drug is dedicated to BPD, but certain medications can help manage associated conditions or specific symptoms. Finally, I would like to emphasize the importance of not self-diagnosing. BPD is a complex condition, and diagnosis requires a comprehensive assessment by a qualified healthcare provider. Self-diagnosis can often be inaccurate and even harmful. If you or someone you know identifies with these symptoms, it's crucial to reach out to a mental health professional who can provide a thorough evaluation and guide you towards appropriate treatment. Thank you for joining us in this important discussion. Understanding borderline personality disorder is a key step towards addressing mental health issues more effectively. We hope you found this presentation informative and helpful. If you enjoyed this content and wish to learn more about similar topics, please show your support by subscribing to our YouTube channel. Remember to click the bell button to receive notifications about our latest updates. Your engagement helps us continue this journey of understanding mental health together. Thank you.